So when someone's like, oh, well, that page where you said consistency just means, giving yourself grace and showing up in whatever way works. Like, I just had your voice in the back of my head every time I said that I shouldn't do this. So that's the best compliment. Is somebody telling me something in their book is specifically applied to something in their life.
When was the last time you were on the podcast? When was that? A while ago, right?
I feel like it might have been 2020.
Which is both yesterday and 13 years ago.
10 years ago. Yeah.
How would you give people your superhero backstory? Like if someone runs into you at, a big PT event, how do you introduce yourself, or what things about yourself do you usually share?
Well, I'll give you the automatic one, which
Okay.
is like my TikTok intro.
I like it.
Your friendly neighborhood physical therapist, certified yoga teacher, and author of Movement for Everybody. That's me.
So then if they double click on Movement is for Everybody,
Yeah.
what is that? Who's it for? What is the goal? What are they getting out of that?
Yes. So, Movement for Everybody, the book that I wrote, is for everybody to get acquainted with movement, whether or not you've been a seasoned weightlifter or you've never exercised in your life, but it's really a roadmap and journey to understanding how your body works, how to set goals, how to understand pain, how to modify exercises, and really how to divest from just toxic fitness culture, from healthism, from all the nonsense that just keeps us playing small.
Yeah.
So it's not just an exercise book. It's not just a book that you open and say, here are some exercises. Really is framed by my personal experiences in a chronically ill body, my patients, all of the sports and things that I've done. And I also just kind of felt like if I, as a physical therapist, have a patient coming in and you say I have knee pain and all I do is say, here are 10 exercises and send you on your way, I didn't do my job.
And if that's our only value, I would be nervous.
Exactly.
Be real. Because there are ways to find those things, right? Someone could write a protocol and create a PDF or a playlist on YouTube, and if that's your only value, I'd be real nervous. What I find funny is I bought a humidifier the other day, and it came with an instruction manual that was probably like 8 pages long. Now, keep in mind, 2 of the pages were like there for legal reasons, like do not throw in a pool and things like that, things that need to be included. But the reason I find it so funny now is we got a big, complicated human body that came with no book. There was no instruction manual whatsoever. And you would say, well, yeah, we should have one of those for typical people or non-typical, but like no one's typical, right? Everybody's sort of, we look at each other and just think that we're all the same, but then we look at ourselves as individuals. Well, I'm a little bit different here. I do this, I do that. So is that sort of what the reason you wrote that was to make sure people understood enough, and then also probably an underlying message that not everything is exactly the same in all of us. It just isn't.
Absolutely. Absolutely. And that's kind of the journey that the book takes folks through. So there is a lot of journaling in there. It's not just movement exercises. There's a lot of journaling because some of the things that we have in our brains didn't come from us. Like who told you that? Like who told you, well, if you want to do yoga, you have to be skinny and flexible. Who said that? Right? Or who said, well, you have bad knees, so you could never squat again. Who said that? Who benefits from that? Yeah. Not you. So it's very much for everybody from the spectrum of someone that is totally comfortable with exercise, or someone who has an injury, somebody who's new. It really is not an instruction manual, but it is a foundation layer. It is something to build from.
It'd be difficult to write an instruction manual because you would almost need to have one for everybody, and that's not scalable.
I don't have enough time for that.
And we all grow. We start at different places. We have different things, and then we grow and change at different rates. So a manual is not possible. So you actually have a great outlook on this, especially in terms of our profession, which is as PTs, we learn how to pathologize and prescribe. But I don't know anywhere in the syllabus or in our clinical education. Maybe some people did this, and that'd be great. But that would be maybe great. We aren't really shown how to enjoy movement and teach others to enjoy movement, and to deconstruct the harm of healthism, which is, like you said, if you have back pain, these are the 10 things you should do.
Yeah, and everything is well within your control. Every problem that you have is pretty much saying every problem that you have is your fault. Do better. And that, at least in my experience of PT school, is how it went. Like, we were
What?
still okay with telling people, oh, well, if they're non compliant with their HP, that's their fault.
Right.
Yeah.
When you put it back, when you put it like that. Well, I mean, in defense of PT school is no. Yeah, that should be in there somewhere. I was going to say in defense of PT school, they have a lot of information
Yeah.
to convey, and they do a pretty good job of that, and that's a conveyor belt approach. But I don't think it's terribly. It would be terribly difficult to include something like that as a lesson. Do you?
I don't think so. I don't think so at all. I mean, unfortunately, that is the system working as designed, right? I mean, when somebody created PT school, what models did they go off of? The medical model. They went off of, med school, what exists already, and just copied that. So unless you kind of step out of that idea, then you're going to be teaching the same thing. Like, I never even heard of the word healthism. I don't know what that meant. I never heard of social determinants of health.
How do you define healthism?
So the TLDR version is believing that every person's individual choice affects their health. Like, every individual is fully responsible for everything in their health. And so I could say I eat right? Whatever that means to you, being vegan or avoiding dairy or whatever. I exercise daily. If I live in Cancer Alley, baby, I'm going to get cancer. I can't, I can't change the air, So that kind of mindset of, well, if something is wrong with you, it's because you made a bad choice.
If this person has A, do B, and then C will happen. And I don't know about you, but very rarely does that ever actually. I mean, it's messier than that. In a good way. It's because we deal with people, and people are messier. And that's what makes it frustrating. But also, it's the way it is. You're not going to change it. But also, sort of makes it fun.
Yeah, it's messy. It really is messy. It's not cut and dry. And so, I mean, I do my best in the book to, talk about things in sections, but there is not much like cohesive learning in PT school either. And that's something I had to learn on my own. I'll go back to the knee thing. If somebody comes in with a knee problem, all you do is knee this, knee that. And it's like, well, actually, they happen to have multiple sclerosis and their mom died last week.
Yeah.
That's going to change things.
That doesn't fit nicely with CPT codes.
Yeah, that's going to change things. The grief is going to change things. Their availability is going to change things. Their mood is going to change things. And maybe they'll have a little flare up. So this is not something I could just go to, all right, MS year 2, page this on the knee and stick to those pages. That's not going to be good enough.
Right.
Yeah.
How would you explain that this is the way a PT student or a new grad PT should apply this sort of viewpoint or this way of looking at people to practice going forward when they're just still trying to make sure they understand the difference between a tibia and a fibula? Because this is complicated, right? It's
complicated.
Hard enough to know, just how to use the EMR, and now you've got to do this again because it's people and we're messy.
Very messy.
What would you say to a classroom of third-year PT students who are going to graduate soon of the importance of this? Well, obviously you wrote a book about it, so you'd say read the book, right?
Yeah, I mean, because the book is
understand that.
Yeah, the book is towards people, right? But health professionals will benefit from reading it as well because it's going to give you the language and the tools and the framework if you don't have it. But yeah, to the group of students, I would say just everything matters. Everything matters, and you're not in a rush. Because we have a sense of urgency, especially when we're doing our clinicals or we're doing our tests, and it's like, oh, I have to solve this case study in 20 minutes. We're not in a rush.
I know, I felt like that though.
Yeah.
Right?
Absolutely.
Because you went into a model. Like, someone actually asked a question today on social media that I thought was interesting, and it was a non-healthcare provider, and they said, why in physical therapy do people go through their care in these big open rooms? You'd never see that at your GP's office. You'd never see that you sitting there talking to your general practitioner in a room full of 30. Even in the emergency room, when time is better, there's at least sheets and things like that. I know there are some sheets in some practices and things like that. And people chimed in, time and money. So it's like if I'm evaluating someone, but also I need to be in line of sight of this person. So it was a necessity out of that. So it's interesting how these things popped up or how they came to be based on other factors, not what's best for the patient or might be best for them, but what was what was scalable. And that's sad, unfortunate.
Here's a question for you. Do you want to boost your clinic revenue by $290 per patient per quarter? Of course you do. That's rhetorical. Physiotech's remote therapeutic monitoring can help you do that. Enhance patient outcomes, ease provider workload, and turbocharge your earnings. Kickstart with RTM at physiotech.ca. That's physiotech.ca. And the thing you interact with the most at your clinic, if you're a therapist, like it or not, is your EMR. MW Therapy's all-in-one outpatient PT EMR gives you seamless integration of patient portals, marketing automations, and billing, all at one unbelievable value. Switching over is a breeze too. Kick the tires, take a test drive at mwtherapy.com. And where is your PT career going? It's not rhetorical, it's literal. Embark on extraordinary patient care adventures with Jackson Therapy Partners. Visit them at jacksontherapy.com. This is perfect for physical therapists eager to make their mark, to do what you want to do, where you want to do it. Discover where your career can take you at jacksontherapy.com.
Yeah, it is. It is. It is very hard to say that you work in healthcare when a lot of things don't feel like it's caring. It's not really giving care. It's giving profit.
Yeah.
But yeah, we're not in a rush. And it's honestly, there are times where I am done assessing a patient in 15 minutes, but I'm going to sit there and let them tell me their story because it might give me more information. It might help me figure out how to help them better. And then at the end of the day, they don't feel rushed either. So now they trust this process even more because they're like, okay, this person actually cares about me. I'm not just a number to them. And I could gain more information and we grow together. And that's the other part of it. Everything matters. We're not in a rush and it is collaborative. There's no hierarchy. Yes, we are PTs and we went to school and we're the experts of things. Sure. But that doesn't mean we are the lord of other people's bodies or experiences. It's collaborative. So somebody is giving you the opportunity to join their care team and you're bouncing off of each other. These are ideas that I have, try this out. And they come back, that worked, that didn't work. Okay, great. Here's some more ideas I have, let's try this out. Back and forth. Learning in both directions.
You and I have something in common. I love what you said. You said we don't all have to like the same movements and exercises. I remember somebody asked me when I was in PT school, a friend, what's the best exercise to do for blank? And then someone gave me some great advice on how to answer that question. And I said, the answer to that question is a question, which is, in my point of view, what do you like to do? That's how I always answer that question. So it sounds like we're sort of aligned there, which is you don't all have to like the same movements and exercises. There's not that wouldn't exist. It's like saying we all like the same foods. How do you tease that out when someone says, what should I be doing for this?
Right. So I do also like to separate the thought of every movement isn't going to be joyful, but everything needs to be intentional. So sometimes you do need to do boring things. Fine. But at least in your mind, you're like, I'm doing the boring thing so that I could do this fun thing. So what is the fun thing? What is fun for you? And also reframing what counts, quote unquote, as exercise and movement, right? So, I have a lot of friends who they don't hit the gym. They don't run, they don't get on cardio equipment, but if we go to a swing dance, baby, they're dancing all night long. Their cardio is amazing. Their endurance is great. Their ankle stability is top tier, That is exercise.
How do you explain the difference then between movement with purpose and exercise? And I don't expect you to have the definition because I don't know I feel like if you ask 100 different people, you're going to get 100 different answers. But if someone says, I do, like you said in the beginning, right? I eat right, or I exercise a lot. Well, it's so different from people. How do you ascertain what that means to them and then maybe help them understand that that's maybe one component, something that they need to change their view on, or you give them a chance to change their view on?
Yeah, that is the other part of not being in a rush, is being able to connect with someone and asking them, well, what do you like to do? So, you might be with, let's say, an elderly patient, an elderly woman who most of her life took care of her kids and her family, and she never had a gym membership in her life. She doesn't know what lifting weights means, right? But she knows that she wants to pick up her grandkid.
Right.
She knows that she wants to go to the playground. and go up and down the stairs and do all of that sort of thing. So it's like, if she's at a point where that is hard for her, that is exercise.
Sure.
So it is really tough to kind of separate what counts as quote unquote exercise. So yeah, really speaking to the individual on what they like doing and what that load is for them.
What's something that would be considered to you a good compliment from someone who has read your book and then implemented some of the ideas in it, like 6 months later? What would you consider as successful and a good compliment, or a good response that you'd love to hear?
A good response that I love to hear. I like that question. I think that, again, there's so many topics covered in that book, but I think that every person is going to find like the heavy hitting line for them, like whatever season they're in. So when I hear that kind of a feedback, that really makes me feel good. So when someone's like, oh, well, that page where you said consistency just means, giving yourself grace and showing up in whatever way works. Like, I just had your voice in the back of my head every time I said that I shouldn't do this and I shouldn't do that. And I'm like, oh, you think of me? Like, you have my words in your head? Oh, that's great. So that's the best compliment, is somebody telling me something in their book is specifically applied to something in their life.
Yeah. And sometimes it might have been they might have heard it 99 times and yours might be the 100th. And it's always a different way at a different point in that person's life. And maybe yours was the one that landed or made sense or finally clicked. Is that why you decided to write? Because as a clinician, you're going to touch lives every day, but this is a way to sort of photocopy some thoughts in your voice, right? Written down.
Yeah.
The ability to sort of send that out to the universe and sort of multiply yourself.
Absolutely. I'm going to hold that. Hold on. I have a thought for that. I'm going to hold that thought, but it just reminded me of touching people's lives. I work with all ages. I do geriatrics. I do kids. And you just never know what's going to stick, like you said. So like I have one kid, he had spinal muscular atrophy. All of his siblings are quote unquote typical. Everybody around him is walking around and he just keeps getting weaker and weaker. And then I just showed him, and he's like, well, I want to exercise like my dad does, da-da-da-da-da-da. And I just showed him a picture of a wheelchair bodybuilder. I was like, you could be like this. It was a 10-second conversation. He's 7. Like, we moved on. But a month later, his mom's like, I don't know why he keeps on showing me these pictures of buff people in wheelchairs. What is that? And he keeps doing sit-ups every day. That was a 10-second conversation. Now this kid's doing sit-ups every day because he wants to be a wheelchair bodybuilder.
Listen, if you're running a PT practice and you're still using old school systems, you're leaving time and you're leaving money on the table. Empower EMR is here to change that. It's an all-in-one, automated and built to streamline your scheduling, billing, and everything else so you can focus on what you do best, helping patients. Don't overthink it. Go to empoweremr.com. That's empoweremr.com. Book a demo and stop letting outdated tech hold you back. All right, PTs, if you're serious about crushing the OCS exam or leveling up your clinical game, Current Concepts of Orthopedic Physical Therapy, 5th edition, is where it's at. This is your one-stop shop for the latest in ortho PT, with expert insights on every joint, real-world case scenarios, and evidence-backed techniques. Don't sleep on this. Go to orthopt.org right now and get a sneak peek and start prepping like a pro. That's orthopt.org. One more time, orthopt.org. Go there.
Because he thought you were the right person to ask, and then you gave him an answer that sort of highlighted the fact that that's possible.
Yeah. And that feeling is something that I'd like everyone to have an opportunity to experience. I can't be everybody's physical therapist, but I could write the ideas down. Like you said, I could photocopy it, put it on paper, send it out to the world.
Yeah. A decent chunk of what we do, and especially in the title, is physical. But you say that some of the things we need to pay attention to, or some of this, is mental exercise as well. Movement requires mental exercise as well as physical exercise. What's that mean?
Absolutely. So and that's why I said earlier, every movement might not be joyful, but every movement should be intentional. Why are we doing it? Is it just a chore? Is it to chase thinness? Is it to reach a certain aesthetic or ability that we decided makes us worth existing? what is it for? And if we're not able to answer those questions, I mean, you could be as the buffest guy in the world, but deep down inside, if you hate yourself, I don't think that counts as health.
How was it seeing your book in print for the first time? That's got to be a pretty cool feeling.
It was pretty cool. It was pretty cool. And I actually put a lot. I don't know how involved authors are. And mind you, they probably didn't think I was going to be that involved. I'm a physical therapist. I've never endeavored to write a book. This happened very randomly, honestly. But I was on them. I was like, can you check that contrast? I don't like that font. Can we put some more spacing over here? I don't like the order of those pictures. This one looks the white balance is a little off. Can we fix it? So to see it come out and like see all of the changes that I put input in, I was like, yeah, that looks exactly how I thought it should.
Yeah.
It was good.
Movement for Everybody, an inclusive fitness guide for better movement. Build mind-body awareness, overcome exercise barriers, and improve mobility. You can get that on Amazon right now if you search for Movement is for Everybody. What didn't I ask? You said you had a thought and you were going to save it. I didn't want that to go away.
Oh, yeah, how I got to the book. That's what I was going to do. Because like I said, I never woke up and said I need to write a book. It came to me.
So what's that mean? What do you mean?
I wrote a chapter in a book called Deconstructing the Fitness Industrial Complex. So that's written by my friend Justice Rowe, Rock Rashawn, and Lawrence Cavall. And they are all trans, non-binary personal trainers, coaches, different backgrounds. And they got a bunch of fitness professionals, healthcare folks, kind of together to share their experiences, with movement, with healthcare. So my chapter is about, being a physical therapist, becoming chronically ill, dealing with changes and kind of getting through it. But there are other chapters like a yoga instructor who's South Asian talking about, authentic yoga practices. There's someone talking about going through menopause. It's just an awesome book. But that publisher approached me and was like, that chapter was pretty cool. Have you considered writing a book? And I said, sure, I guess I could. And then that was it. Now I'm suddenly passionate about an idea that wasn't even mine.
But then you got to put, that's not, I don't think that's usually how it starts, especially for a first-time author, right? Usually you've got to go to them. You've got to pitch yourself and your idea pretty hard. But them coming to you, I'm sure it happens, but probably not as often.
Yeah, no, that's not something that I expected or saw for my my life, my career, my professional development, whatever, what have you.
Feedback is something that we at least look for, either in practice or from patients afterwards. And I'm sure you've gotten feedback, and we've things like ratings and reviews and things like that on the book. Right. Has there been a story or someone who's reached back out to you after they've read all or some of it that has left an impact on you?
That's a great question. So I will say I'm not even touching reviews. I don't care to read them. Only because they sent advance copies to folks, and then before my book came out, it had reviews already, and some of them were just like, did you even read this, or did you just do this for a job? So so it was weird. So I'm like, you know what? I'm not even going to read these. And the publisher also recommends, like, you don't read them because it might hurt your feelings. So I'm just putting that out there. But as far as personal stories go, yeah, there are a lot of folks that have come to me and said, well, you had this section on pain and all the different specialists that you could see, the different kinds of pains that exist. And now I'm realizing that maybe I need to see a specialist. And I never thought I did. I thought this was normal. I thought everybody went through this.
And just knowing that someone's talking about it can be huge, like a big deal, just a really big deal.
Absolutely.
Yeah.
Absolutely. And I have another friend who was like, I really appreciate how much you emphasize safety, like mental safety, emotional safety. Like, read this book in a place that is comfortable. There's a lot of things that are like, make sure you have a comfortable space. Make sure your space is quiet. Make sure this, and like, my book starts with reading tips and preparations. Like, it starts with, you're going to need all of these things, and also this is how the vibe should be. And so she, as a trauma survivor and someone who's kind of overcoming, how to exist in her body peacefully, felt really at ease that the book started with that.
Is there anything I didn't ask that you hoped you'd get to talk about that you want people to know?
I don't think so.
Well, good. That means I did a perfect job and I knocked
Amazing. 10 out of 10.
10 out of 10. Last thing we do on all of the episodes is what I call the parting shot. That's just a chance for you to either break out a new mic drop moment or soapbox statement, or you can repeat something that's been said before just to put emphasis on it. But what's the last thing you'd want people to remember as we wrap up?
The last thing I'd want people to remember. I think that we very much downplay the impact of movement. And that especially when we're worried about, let's say we're worried about politics, we're worried about where the world is going, we're worried about climate change, we're worried about this and that. And yet we are still viewing movement as a chore or as punishment. We're missing something. When we were kids, we just went outside. You just opened the door and said, Jimmy, go play outside. It was play. Like, we need space for play, for pleasure, for joy. And movement should be a place that you could find that.
Love it. Books available on Amazon. Would you want them to go anywhere else to get it? Sometimes if they go directly to you, you get a few extra nickels.
So it won't make a difference to me, but what would make a difference is finding your local independent bookstore.
Love that. I've got my little book nook myself in my community. I like working out there. It gets good stuff. Appreciate
and there's always the library too. If you don't have the funds, that's fine.
It's a whole building of free books. People don't understand that.
Who put that there?
Who put that in most communities? There are hopefully more communities. But appreciate you taking time to do this and giving us a little insight into why you did it and a couple different perspectives on how we can look at things differently.
Yeah, thanks for giving me the space and time to do it. It's a pleasure seeing you again.